immunization.
Across Cross River State, over 900,000 children between the age of 0 to 59 months will be administered with 2 drops of oral vaccination to help build their immunity and protect them from a wide variety of poliomyelitis virus, as well as complementary medication for other antigens. This is according to the Director General of the Cross River State Primary Healthcare Development Agency. According to the agency head, so far, Cross River State have recorded impressive outcomes in previous exercises through the combined efforts of stakeholders.
Recently, in some states, the type 2 virus re-emerged, and that's why the outbreak response was introduced to see that we can, curb the spread. It was part of proactive measures being put in place by the federal government to protect our children and ensure that we do not record cases of polio, particularly the type 2 polio virus.
It is a proper.
The Director General of the Public Health for the Cross River State Ministry of Health applauds the state government for their political will to support immunization in the state, adding that mothers and caregivers should not compromise on the platform intended to create a new pathway for the country.
Mothers should know that immunization is necessary and compulsory for children. We are not only limiting ourselves to only immunizing the very small ones, because we also need to be protected to survive and look after the young ones. So for all of us who are here, I urge all of you to also make sure that you follow your own schedule of immunization in terms of COVID and the rest.
Parents and caregivers who have benefited in the vaccination exercise thank the government for such a move, adding that it will help their children grow in good health.
It's a very good exercise, at least to an extent, because it will help we mothers to be sure that our children are free and they are healthy.
Look at our children, they are very, very healthy because of this immunization that are given to our children. So I am here to thank government for all what they are doing to us.
The state government is calling on all parents and guardians whose children are between the ages of 0 to 59 months old across the state to ensure just that.
And now the Director General, Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpeyong, joins us from our Abuja studio to tell us more about the coverage of poliomyelitis in Cross River State. Dr. Ekpeyong, thank you for joining us.
Thank you so much for having me.
Indeed. First of all, tell us about the exercise, the coverage. 900,000 is quite a number. Does Cross River State have the healthcare personnel to achieve this target?
Thank you. Yes, we know how dilapidating the polio effect can be in the lives of children. And that's why every now and then federal government and state government, of course in collaboration with all our international organizations or partners, bring in this high impact intervention to ensure that we can vaccinate children against polio. We know, yes, for Cross River State, the target for this year is actually 900,000. You might be interested to know that when we even did the first outbreak response, because this is the second one, we actually exceeded the 900,000 target. We got almost 1 million children, vaccinated against the type 2 polio variant. And we indeed have the personnel to help us in this regards, because we ensure that not only do we rely on people coming to health facilities, we set up other mobile teams. We have some other temporary sites, and of course we have enough manpower to help us achieve this.
And then the state government is also setting up border patrol teams. Tell us what the borders have got to do with this exercise. Okay, so polio, it's one of those diseases that you just have to ensure that you cover every area of your state just to ensure you can protect the children. The good thing is that in Cross River State, we've not recorded any type of polio. As God will have it, also we're able to eradicate all the variants totally from the country. Just sad that a few months ago
last year, the second variant was recorded in some states. And as part of our proactive measures to ensure that we continue to protect the children in Cross River State, we ensure that even those very places with very difficult terrain, we have health workers combing those very areas. And Cross River State is one of those states that has some very difficult terrain. People have to go through water, climb mountains, and the rest of it. And the good thing is, and another interesting thing is that we share border with Cameroon. And so what we try to do is to ensure that border synchronization, where the closest communities from that country, we go into a partnership where we're able to also get children in that community vaccinated to ensure that at least if for any reason we can protect our the children closest to Nigerian border as well as our own end, just to ensure we prevent or even avoid polio coming into the country. So we have that external synchronization as well as an internal synchronization, because even within the states, local governments also try to synchronize as well as ensure that at least there's that harmonious working relationship to ensure that the children across the LGAs are also vaccinated.
And just to establish that the response has been the same as what we've seen in the cameras, have the women, the mothers and the families been cooperating with your personnel?
Absolutely, and that's evident to the fact that we've not recorded any case of polio, because we've done a lot of sensitization, a lot of advocacy and continuous education. And we've also worked with a lot of stakeholders in this regard. And so we are not relenting, and that's why everyone is aware whenever we start such campaign. You see mothers taking their children themselves or caregivers taking their children themselves to health facilities. And even when we set up some temporary sites or healthcare workers going into their homes, there's always that reception, and I'm very pleased that they understand the need to protect every child, because once one child is infected, then it becomes a big problem for the states. And I'm glad that everyone has been working cordially with the state government to ensure that we can protect all the children within the targeted age in Cross River State.
And away from your immunization exercise now, the president just yesterday signed into law the National Health Insurance Bill. It's a bit early in the day, but perhaps you can give us an insight into the implementation strategy that Cross River State has put in place for this.
Thank you very much. So the good thing about the health insurance is that that's a more reliable and sustainable way of financing the health sector. And if you must ensure that we achieve universal health coverage, where everyone can have access to quality health care, irrespective of their financial status, then you must have a functional health insurance. And now the previous National Health Insurance Scheme Act, had a lot of limitation. So with this new health insurance bill, so many good things will actually will be coming up. Yeah, for instance, even the name itself has actually changed from National Health Insurance Scheme to now a National Health Insurance Authority. So they will be able to at least regulate every health insurance scheme or in every state, ensure that at least we can achieve optimal output from every scheme that the states are set up. And of course, there will be that stronger collaboration with states to set up their own scheme, because I'm also glad that there's that decentralization, and more states have also keyed into this national policy. And another very key and important is the fact that it means everyone that is eligible should be enrolled to benefit from the health insurance scheme. Before we only saw just the organized private sector, as well as
formal sector being enrolled into the scheme, but now it gives opportunity for everyone, to be enrolled, to have access to quality healthcare. Another very beautiful thing is that there's also fund for the vulnerable. This will allow the vulnerable groups to have access to free healthcare without having to break banks. And when we talk about the vulnerable groups, that's children under 5, pregnant women, the aged, people with disabilities. With this bill, a fund has also been set up to finance them. And from the basic healthcare fund, they will also be funded from other funding sources.
We hope that all of this accruable benefits
and providing healthcare services
will go round, just as you've talked about it, Dr. Janet Ekpeyong. We really have run out of time. Thank you very much indeed for your time on News Across Nigeria.
All right, thank you very much.